Hello and welcome to this UniTaster On Demand event today. My name is John Cheek. I'm here from UniTasterDays, and today we're going to be exploring university courses in pharmacy. So with these events, we cover four main things: why you might want to be interested in actually studying the course, what to expect on it, an idea of application tips, and also potentially discussing some potential careers you might go on to in the future. And I'm delighted to be joined by Dr. Sam McLean, joining us from the University of Bradford. Sam is the Director of Marketing and Admissions in the School of Pharmacy and Medical Sciences at the University of Bradford. And with that, Sam, I'll pass things over to you, please.
Hi everyone, and welcome to today's session on pharmacy. I'm going to give you a quick overview of why you might be interested in studying pharmacy, what to expect, a little bit about careers, and then probably most importantly, tips for application. So why might you be interested in studying pharmacy? Well, pharmacy at the moment is a really exciting area of growth. So you've probably seen on the news a lot about how GPs are under a lot of stress and the NHS is under a lot of pressure. And what the NHS have introduced is a way to combat this is something called the long-term plan. Now, this is a 5 to 10 year plan that is planning to recruit thousands of more pharmacists who will be supporting GPs, and they will be prescribers. You will be going to the pharmacist to get advice on diagnosis, to get medications, and to get support. So everything that you would have gone to the GP for, there's now a push to try and upskill pharmacists to be able to take some of that pressure off. So that means lots more jobs in pharmacy coming up. So it's a really exciting area for pharmacy at the moment, and the profession is changing quite a lot. So what is a pharmacist then? A pharmacist is an expert in medicines. So you have to understand how medicines are made, how they're formulated. You also have to understand different diseases and how they're treated. But as well as having that science knowledge, you are also a professional. So you have a legal responsibility as a pharmacist for the safe dispensing of medication and the sale of medications over the counter to the public. So you've got to learn a lot about different classes of medications and the law that comes with that. You also have to know about how to educate and support patients in how to manage their medicines properly, so to make sure that people know how to take the medications. You also would be helping patients with some minor illnesses and how to prevent disease as well. So one of the things that pharmacists do is they often give advice around things like diet and exercise to try and prevent things like diabetes occurring. And as I mentioned before, with the NHS long-term plan, in the next few years, all pharmacists, when they qualify, will actually be prescribers. So you'll also, as a pharmacist, be able to prescribe medication probably in the next 5 years. So what about the different careers in pharmacy then? You probably think of pharmacy as somebody who works in Boots or Lloyd's or a high street pharmacy. And that's just one area of pharmacy. So around 2/3 to 70% of pharmacists actually go into what's called community pharmacy. So this is where you're handling prescriptions day to day, you're selling medications over the counter, you're giving advice to patients on whether it's a minor or a major condition, whether they should go and see the GP for more advice, or whether they need to go to a hospital if it's an urgent matter. But you also have a big role in preventing disease. So things like vaccination programs, the flu vaccine, you'll have seen obviously on the news the role that pharmacists have played in the rollout of the COVID vaccination program. So pharmacists do a lot around making sure that patients are safe in the community. Then you have around a quarter of the profession going to hospital pharmacy. So in a hospital, as well as having obviously doctors, nurses, there will be a pharmacist that's working on the ward, and the pharmacist will be the expert in medication on that ward. So lots of the times the doctors will come to the pharmacist for advice on how do we start a patient on a new medication, what drug do you think we should give, what dose should we give, and you as the pharmacist will be advising the doctors and the consultants about what medication to give and how. Also in hospital, there's some other areas that you could work in, as well as being a specialist on the ward. You might actually work in manufacturing of medication. So for example, if you think about chemotherapy to treat patients with cancer, that has to be made up in very sterile conditions, and it's often pharmacists that would be making up that medication in the hospital. Then a very small percentage of pharmacists can actually go into industry. And this is probably the least area that's known about for pharmacists, but you could go into research and development. So remember that pharmacy, as well as helping patients and educating patients, is a scientific degree. You are a scientist when you finish. You might want to go into research into how new drugs are made to try and treat conditions. You might want to go into formulation. So for example, we've got a drug that's in a tablet form, but actually we need to give the drug as an inhaler. How do we get it from the tablet to the inhaler form? And that's where formulation science comes in. Also in industry, you might be interested in the licensing. So when drugs are coming to the market and they have to go through lots of safety checks, pharmacists are often involved in this process. And also around things like clinical trials. When a drug's being tested in patients, it will be the pharmacist who will be giving that medication to the patients, because somebody legally has to have that responsibility of giving that medication to patients, even in a clinical trial setting. So there's lots of different careers that you can go into with pharmacy. It's not just high street working in a chemist. They're a really broad area of careers, and it's just getting broader. So as I mentioned, with the NHS long-term plan, there's some really interesting areas of growth. So this area around primary care or GP practice pharmacy is a really big emerging area for pharmacists at the moment. So now a lot of the time you will see, if you go to your doctors and you go to the GP surgery, that there'll be a pharmacist attached to that practice. So those pharmacists are often independent prescribers. So they will see patients and try and diagnose and treat the conditions that they're presenting with, and then prescribe the medication. So lots of pharmacists are now running clinics within GP surgeries. And you will now also see that lots of pharmacists are employed in a care home setting. So you'll have probably seen that, we have an aging population. We know that generally our population is getting older, and with that comes lots of diseases, things like dementia, Alzheimer's disease, and patients are living longer, and lots of these elderly patients are on lots of medications. Now, when people are taking lots of medications, they need lots of advice on how to avoid interactions, how to avoid side effects, and how to take them properly. So elderly people, for example, might struggle to swallow tablets, so they might need their medication in a different formulation. So lots of pharmacists now are working in a care home, and this care home pharmacist role is one that's emerging, and this is becoming a bigger area as well for careers. But there are also careers then outside of being a pharmacist at all. You could, for example, do what I do, and you could work in a university setting. You could be teaching students about pharmacy. Some pharmacists go into management roles within the NHS, or even into publishing, and some go into further study. So you could do a PhD where you're actually researching either a disease, either a new drug, or you're researching how patients take medication, what we call medicines optimization, and how best to support patients. So there's lots of other areas actually outside of just being a pharmacist that you can still go into as well. So how do you become a pharmacist then? Well, there are two routes to being a pharmacist. So a pharmacy degree is a 4-year degree. It is an MPharm degree. And then what happens at the end of that is you do what's called a pre-registration foundation year. So this is a 1-year paid employment that you do at the end of your degree, where you have to be signed off on a range of competencies. So you're working in practice every day with a qualified pharmacist who's supervising you in that role. And then at the end of that pre-registration year, you do the General Pharmaceutical exam. So the General Pharmaceutical Council are the accrediting body for pharmacists. And to be a registered pharmacist, you have to pass that exam at the end of that pre-registration year. So everybody does that in the UK. You do a 4-year degree, and then you do 1-year training, and then you sit an exam to become a fully qualified pharmacist. So that takes you 5 years in total. At Bradford University, we actually offer what's called a sandwich program, and we're currently the only school of pharmacy that do this, but the GPHC are now recommending that more schools of pharmacy start to move to this model. So this is where we have that 1 year of pre-registration training, but it's actually incorporated excuse me, into 2 6-month placements. So what we have is you do 1 6-month placement at the start of the 4th year, and then you do another 6-month placement at the end of the 5th year. So the degree this time takes 5 years, but within that 5-year degree, you've already completed that pre-registration foundation year of training. And then after your degree, you sit the registration exam straight away and become a qualified pharmacist as well. So there's 2 routes. Both routes take 5 years. It's just whether or not you want to do a sandwich program or not. One of the benefits of doing a sandwich program is that you get 2 different types of experience of pharmacy. So you could, for example, do 6 months working in a community pharmacy and 6 months working in a hospital pharmacy. So if you're unsure about what type of pharmacist you'd like to become, doing a sandwich program where you can do 2 placements actually gives you a chance to test the career, see what's right for you and see what you want to then specialize in at the end. So what should you expect then on a pharmacy course? So as I've mentioned, it is a pharmacy degree. So typically you would do lots of modules in basic biology. So at Bradford, our module is called Human Body and Health and Disease. And this is kind of a physiology module. You're learning about the body. You're learning about the drugs to treat diseases in this module. We then have life cycle of a medicine, which is typically a chemistry-based module, pharmaceutics, how you deliver medicines to the body. We then have a health and well-being module, health psychology. So this is things like looking at behavior change, whether somebody, for example, wants to stop smoking, how can you support somebody with stopping smoking, and what tactics should you use depending on where they are and how ready they are to change. We also have professional practice. So this is often related to dispensing prescriptions, knowing a lot about the law, knowing a lot about ethics and what you should do, professional decision making. And then lots of universities will also have different skills that they develop. So as a pharmacist, you need lots of really good communication skills to be able to talk to patients. You need to be able to work with different healthcare professionals. So teamwork's really important. So lots of modules at university will be looking to develop these skills and capabilities to make sure that you are an all-round pharmacist who doesn't just have the knowledge, but has the skills to be a good healthcare professional as well. And then you will get to do different electives. So you can choose if you're particularly interested in chemistry, maybe you want to do a chemistry project, or if you're particularly interested in a disease, let's say Alzheimer's disease, you want to focus your elective on that. So we offer electives all the way through courses. So for example, you can do them in the first year, second year, third year, fourth year, all the way up. And most universities will do that as well. That's quite common across the board. So another important thing to think about when you're studying pharmacy is how would you actually study? So you're going to spend a lot of time at uni. It's a very full-on course. So typically our first year students are in around 30 hours a week. So it's like a full-time job really being at uni doing a pharmacy degree. But you want to know how are you going to spend that time? So some of the time might be spent in lectures. At Bradford, we use something called team-based learning, which is where we actually don't do very many lectures. We give you a lot of reading in advance, and then you come into class and you use the reading that you've done to solve clinical problems. So this is like problem-based learning. One of the good things about this is it gives you the opportunity to develop those team working skills and those communication skills with your peers, but it also helps you to get that deeper learning of the topic as well. So some universities are starting to use this model now. So team-based learning is cropping up elsewhere. Some are still using a very traditional lecture-based modules. So it's important that when you're going around different universities, these are the types of questions that you should probably ask, because it's important that you get the right type of degree for what's going to suit your method of learning. You'll also do lots of lab classes. So for example, physiology classes, pharmacology classes, you might be applying drugs to tissue. You will be doing prescription processing classes. So how do you actually label products, getting labels from the shelf, using the computer system to produce those labels with all the right warnings. You will have support seminars. So lots of our students come in for question and answer sessions. We have patients come in that deliver a session and you can ask a patient about the condition. How do they like to talk to the pharmacist? What would they like to see from pharmacists in the future? So we have those type of sessions with patients and other healthcare professionals as well. And you will also get to do work-based learning. So a lot of the learning that you do is actually out on practice. So even if you're not doing that sandwich degree, you will get periods where you get to go out and practice and do some kind of work experience, and you'll learn a lot from those periods out on practice. And again, that's a good thing to ask universities about, is how much work-based learning do you get on the program, because that varies from uni to uni. So one of the things that we always get asked about is grades and requirements. And I'm not going to focus too much on the grades because you probably know if you're interested in pharmacy that you're looking around ABB. Typically, most schools of pharmacy would ask for chemistry and biology or one of those plus another science. But what about the personal statement? So with pharmacy, we're really interested in your personal statements. As admissions tutors, we do read these. And the things that we're looking for are really, what is your motivation for doing a health career course? What work experience have you had in a health related area? And this doesn't have to be paid work experience, it could be voluntary. It doesn't have to be work experience in a pharmacy, it could be in a hospital, or it could be in a GP surgery. But what we want to know is that you're interested in health and what skills you've learned. So the important thing is not to say that you've done a week's work experience, but what did you actually learn? What were the skills that you learned while on that work experience that you think you can then apply to being a pharmacy student and then being a pharmacist in the future? Lots of schools of pharmacy will interview students. So I think most schools of pharmacy do an interview. Typically, these are things like competency-based interviews. So they're asking you types of questions. Can you give me a situation where you've done this? And you've got to think about that situation and give an example. So do that preparation beforehand. We at Bradford and lots of other schools of pharmacy are interested that you've got an understanding of the values that it's needed to be a healthcare professional. So of the NHS constitution. So this is things like treating people with respect, being equal and having that diversity. So you might be asked, how have you demonstrated some of those values in what you've done? That could be at school, it could be on work experience. We'll also be looking for questions that really look at your motivation to study the course. So why do you want to study pharmacy? What do you already know about pharmacy at the university that you've chosen? And what type of work experience have you done and what did you learn? The other thing to mention about pharmacy applications is you will need to complete a DBS check and a health check. So this is just to make sure that you don't have any criminal convictions that might prevent you from being a pharmacist or any health conditions that would prevent you from practicing in the future. So all schools of pharmacy will ask you to do this as well. So some personal statement tips. I've screened thousands of personal statements over the years in my role. What we like to see is examples of what you've done. So give us those examples and give evidence to support those examples and say why that experience is relevant. So again, as I mentioned, don't just say I did 2 weeks work experience in a pharmacy. What did you actually learn? So what did you see while you were on work experience? Oh, I saw that the pharmacist was talking to the patient. The pharmacist was working with the healthcare assistant. Sometimes we were having to sell medication over the counter. Sometimes we were referring people for advice. So what types of things did you actually do on that work experience? That's what's going to make you stand out. Also mention if you've had any positions of responsibility. As a pharmacist, it's a very responsible job. So if you work in a shop, for example, and you're handling cash or you're cashing up the till or you're opening and locking up, those are positions of responsibility. That's worth mentioning because it shows that you are trustworthy. That's what we're looking for. You can also talk a little bit about how you would see yourself developing and what type of career you would like to do. So if you've got an idea in your head already that you're really interested in hospital pharmacy, say that in your personal statement and that enthusiasm will come across. And then just check your spelling and grammar, because what we don't want to see is any mistakes in the personal statement. Because as a pharmacist, you have to have really good attention to detail. So we're looking for a very polished personal statement. Then I just want to finish on some of the things that you should ask. So when you're going for an interview for pharmacy, hopefully you get shortlisted and you go for an interview, you'll probably be asked at the end, what questions do you have? And you don't want to sit there thinking of questions. So think of those questions in advance. So what will I study on the course? Are there many electives? Is there much freedom in what I can choose? How will I actually study? Will there be lots of simulation and technology? Is it all lecture based or do you use team based learning? How will you as a university develop my skills? What type of work based learning do I get? So at Bradford, we do 3 days every year. And in the final year, we actually do a day in GP surgery. So that's to prepare our final year students to go into GP if that's what they want to do. So you can ask about that. What does the university offer? Importantly, it's good to find out about the statistics. So something called the NSS score is the student satisfaction score. So what do the students actually think about the course and the university? What are the employability statistics? How many of the students actually get a job as soon as they graduate? And what is that GPHC exam success rate? So do the students who qualify from that university then go on to do well in the registration exam? These are all questions that you could be asking to help you make up your mind about where to study pharmacy. And then most importantly, talk to the students who are on the course. So for example, we have students that interview. So when we interview applicants, we have a member of staff and a student ambassador, and you can ask the students, what's it actually like? How much are you in? How many exams do you have? You know, how do you spend your time? So ask the students when they're showing you around the campus, what do they do on their pharmacy program? And they'll be honest with you. We always tell students, just be honest and tell them what to expect. So it's really important that you get the most out of any visits that you do, any interviews that you have. Use that time wisely with the staff and the students to find out about the pharmacy course and find out if that place is going to be right for you. So I hope that's been interesting for you. Lots of information. Thank you very much for listening, and good luck with your studies.